Hi everyone. Today we're joined by Eddie Dalton. He is a certified registered nurse anesthetist at North Mississippi Medical Center Women's Hospital. Today we're going to talk about epidurals. Eddie, if you would start just by telling us what is an epidural and how does it work?
An epidural is used for pain relief during active labor, childbirth, and it decreases the pain of the contractions. It doesn't take away your movement. You're not completely numb. You do have some pressure. It's not anything like normal contractions, but it's very beneficial for the experience you have during childbirth.
Good. And at what point can a woman ask for an epidural?
Pretty much at any point. Most people come in, they know they already want one, so it's planned for. Of course, if they decide they want to go natural, they can come in and change their mind as long as they haven't delivered yet. Usually, up until delivery, it's an option. It would just depend on how busy the epidural person was at that time. If it's planned, then it's just a much easier process, but they can have an epidural at any point.
Okay. Is it ever too late to have an epidural?
On delivery.
Okay.
If the baby's head is crowning, it's too late.
Okay. And what if a woman hasn't decided before she gets here to have an epidural? Is there something she can do when she gets here? Can she talk to you all? Or?
Absolutely. We get consulted a lot. She can ask to speak to any of our anesthesia providers here at the Women's Hospital, and we can go through all the risks, the side effects, the benefits, what she can expect, what could happen, pros or cons either way. If she doesn't want to do that, of course she can always Google.
Okay, good. And if a woman has an epidural, is she on any restrictions after giving birth as far as staying put?
Not normally. On the best outcome, after they deliver, they will be transferred to the other end of the postpartum floor, and as long as she can move her legs and feel her toes, she can get up and walk.
Good. Are there any women who are not able to get an epidural, or is there any reason why you wouldn't give one?
Well, there's some contraindications, one being, of course, the woman's refusal to get one. Another one would be their plating, their platelets, their blood clotting factors. If they were too low, then we would not be able to do that. If they were allergic to or had sensitivity to the medications we use, we would not do that. Or infection at the side of insertion of the needle.
Okay, good. And are there any risk from having an epidural?
Yes, there are risks. There are several risks actually. You could have a high block, which would cut off your breathing. We would have to put you to sleep for that. That's very, very rare, but it can happen. The most common risk would be a post-dural puncture headache, or a wet tap is what we call it, when the epidural needle pierces the spinal canal and some of your fluid leaks out through that hole and causes a severe debilitating headache. Of course, we can fix that. There are several different options to do that. Again, that's very rare also, but it can happen, but that would be the most common risk.
Okay, and what about benefits? What are the benefits to having an epidural?
The biggest benefit is analgesia, or pain relief. It makes the experience much better for everybody involved, daddy in there. You still feel contractions, but they're not near as painful.
Are there any risks to the baby?
No.
Okay. And is there anything you'd like to add?
I would say yes, please. If you have any questions, consult our team, our anesthesia team here at North Mississippi Medical Center Women's Center. We'll be happy to talk to you. We always have someone available 24 hours a day, 7 days a week. And if you have questions, contact us and we'll be glad to answer any questions you have.
Great. Thank you for being with us today, Eddie.
Thanks for having me.